Falsified medical records, lies, and perjury, of Podiatrist Lawrence Silverberg. Part 2. Podiatrist Lawrence Silverberg falsifies medical records of a patient and lies under oath during his medical malpractice lawsuit. According to legalabeagle.com, fabricating medical entries is a federal crime, covered by both state and federal laws. Misdemeanor tampering charges typically will result in fines and jail time up to around a year. A felony forgery conviction, on the other hand, may result in heavy fines up to $250,000 and possible imprisonment in a federal facility for up to 5 years. To prove forgery, there must be some element of fraudulent intent, for example, where a physician alters records to improve his defense in a medical malpractice suit, to cover up his wrongdoing and make his records fit his version of the story. It shows the physician knew he did something wrong and tried to hide it. To cover up his multiple botched bunion surgeries, Podiatrist Lawrence Silverberg created his own version of the story. In his story, Podiatrist Silverberg claims that the patient got disability because she refused to comply with his treatment and didn't go to physical therapy. In his records for November 2nd, Podiatrist Silverberg writes, "The patient returns 1.5 weeks after Aiken procedure and release of MPJ contracture." He also writes, "I advised her that she is to start physical therapy and using the foot more." Then he writes, "She wishes to do surgery on her left foot. She is on the operative schedule for 1.5 weeks from now." After bone surgery, it takes 4 to 6 weeks for bones to heal. The patient had surgery on October 21st, and during the appointment on November 2nd, she is 1.5 weeks after surgery. Moreover, she is scheduled for another surgery on November 8th, so the earliest she would be able to go to physical therapy would be the middle of December. There is no chance that the patient would be sent to physical therapy on November 2nd, in between the two surgeries, when the bones are still healing. Staying off both feet is mandatory. Clearly, Podiatrist Silverberg forged his records. In his records for November 2nd, Podiatrist Silverberg writes, "There are early stages of disuse atrophy with a mild generalized lucency within the bones. I discussed with her the disuse atrophy, seen on the right foot X-ray. I advised her that she is to start physical therapy, and using the foot more." In the recording of this appointment, contrary to his notes, Podiatrist Silverberg states that the patient has post-surgical pain.
So right now he's still experiencing surgical pain, I think. Once it heals, his pain should go away.
Podiatrist Silverberg acknowledges that after 2 foot surgeries, the toes are on different levels. Some are higher, and some are lower, and he doesn't know why. This is obviously a sign of failed surgeries, but he insists that as the patient will start walking, the toes will somehow come down, which is not true. He contradicts himself and states that he is encouraged, and it's nice and straight now. He never mentions disuse atrophy.
Interesting, this one is higher than the other ones. This one I need to work on. These are now lower than this one.
Okay.
Well, I worked on these to lower them, I didn't work on this one. Okay. So you see when I unwrap it, they're kind of...
No, but you worked on this one, right?
This one I did, yeah.
So what, now you have to cut the first one?
No, let's cut this one. Let's just leave it unwrapped now and put a light wrap, and let's see what happens with added. See it's on level now. So you see, as soon as I unwrap it, it looks better. Concerning this one's up higher than the other ones now.
Because this is the only one that you didn't
I
release.
work on that one, yeah. So let's see.
Can you release it when you will do the second foot?
If I need to, I don't want to do more surgery on you. Okay. So the stand. It looks nice and straight now. It needs to come down a little bit. So the swelling comes down here. So it's much straighter. Can you pull your toes down? Do they move down? Hard to do. You know, I lowered this one as much as I could, and it will come down because it's now swollen up here again. So you see, if I push it, does it hurt? So it's just tight right there. See, it moves right there. It's just tight in there again. So it's going to be good. It's going to come down, I'm sure. See that? It comes down, I press on it. It'll come down in time. As you walk.
So this one again under this, no?
No, it's, well, a little bit. Better than it was before. You'll see, once you start walking and put it in a shoe, this will get better. So I'm encouraged, it looks much better now. Remember how this toe is so tight, because underneath this one, now it's parallel to that one.
Yeah.
So that was why I went back, most of the reason I went back to the second procedure. Nice and straight now. Looks really good, actually. Right, you agree?
Throughout the appointment, he constantly repeats that the X-rays are perfect and everything is perfect, and having pain for many months after surgery is normal. He never mentions disuse atrophy or physical therapy.
I just don't want you to be upset with me. I want you to be happy with your surgery and happy with me. I don't want you to think I did the wrong thing. This looks perfect now. I'm very happy with this now. I wasn't happy before. I didn't like how it looked before. It's much better now. Those will get better. You'll see. Everything's going to get better. You're going to be okay. All right? This is not foreign to me. People have pain after surgery for many months sometimes. Then it goes away. And it gets better. It's over. It looks like it's healing perfectly to me. All right? Everything looks perfect. I couldn't ask for a nicer looking X-ray. I would like for your foot to feel better, but the X-ray looks perfect, okay? What's more important is what your foot feels like. So that looks great.
He was saying everything was perfect in order to do another surgery on the left foot, 2 weeks after the previous surgery on the right foot. He was in a rush. He wanted to make more money from the left foot, before the patient realized that the pain in the right foot was not going to get better, or go away. In his records for November 2nd, Podiatrist Silverberg writes, she wishes to do surgery on her left foot. She is on the operative schedule for 1.5 weeks from now. The recording shows that this is not true. The patient did not ask for the surgery. While the patient complained about problems with her right foot, 1.5 weeks after surgery, Podiatrist Silverberg asked if she is ready for surgery on her left foot. Within 6 days, she replied, I don't know.
So the other day, when I was walking and it became at home, to the kitchen. I was probably in my shoe for half an hour, sitting in the kitchen just drinking tea.
Right.
And it became red over here.
No activity, no walking,
No,
no shoes?
no, I was in a sock and a shoe at home. And when I took off the sock, and it was red. So basically, this story starts over here.
Right.
I didn't go to work, no, it became red.
Yeah.
Yeah, so I have to do this one.
We're scheduled for November 8th. That is another 6 days from today.
Tuesday.
Do you think you'll be ready for that?
I don't know.
You let me know on Monday how you feel.
It is clear that the patient is still recovering, only 1.5 weeks after surgery on her right foot, and Podiatrist Silverberg is pushing for another surgery. Actually, the patient says that she came to check how her stitches were healing, and the upcoming surgery on Tuesday was news to her.
Norma never called me, so I thought that it didn't work out about Tuesday.
Oh, no?
Mm-hmm.
I'm not sure what it's being called.
I thought that basically I planned that I will come and we'll see how my stitches and everything, and we'll talk about it. It's kind of news to me about this Tuesday. Okay.
Put your right foot here and your left under the light.
How is it possible for any conscientious surgeon to encourage surgery on the left foot, when the patient just had revision surgery on the right foot, 1.5 weeks earlier, and complains of constant pain and inability to walk? What happened to the principle, first, do no harm? Podiatrist Silverberg assures the patient that it is perfectly fine to have pain for many months, knowing that having pain 3 months after surgery means complications, and you don't do surgery on the left foot when there are complications on the right foot. In his expert affidavit, Dr. Treppel, who never examined the patient, writes, plaintiff requested an additional procedure be performed on her left foot to address her left foot bunion. An osteon or possible achin were discussed. Dr. Silverberg advised her to have the surgeries performed separately, and that having them performed at the same time may not result in the best outcome. This is not true. It was Podiatrist Silverberg who initially suggested to the patient to do the left foot surgery together with the revision surgery on the right foot. The email sent by the patient to Podiatrist Silverberg on September 29 shows that the patient is worried about the perspective of doing 2 surgeries at the same time. In her email, the patient writes, I think it will be very hard for me to have surgeries on both feet at the same time. So, I ask if you can separate the surgeries. If you can do it, I am ready to do the achin the next week, if it is possible, and then in a couple of weeks the left foot. It contradicts Podiatrist Silverberg's claim that the patient asked for more surgery, not to come back to work. It was Podiatrist Silverberg who was pushing for surgery. Podiatrist Silverberg knew what he did was wrong, so he falsified his medical records to cover up his wrongdoing and improve his defense in a medical malpractice suit. Podiatrist Silverberg repeated all these accusations in court under oath, committing perjury. He created this story to cover his multiple botched surgeries that led to a patient's permanent disability, constant pain and loss of employment. The audio tape of the appointment proves that he committed crimes. He should be held accountable for his crimes in accordance with the law.